Good day. Welcome to the inaugural webinar of the Sunway Centre for Planetary Health based at Sunway University in Malaysia. I'm Dr. Renzo Guinto, Chief Planetary Health Scientist of the Center, and I will be your moderator for this discussion. Our topic for today's webinar is planetary protection, safeguarding health from pandemics and climate emergency in Asia and the Pacific. This webinar is part of the Center's Planetary Health in Asia webinar series. Our main co-presenter for this episode is the Ministry of Environment and Water, Kementerian Alam Sekitar dan Air, or CASA, of the Government of Malaysia. Next week, the world's governments will be gathering in Glasgow at the 26th Conference of Parties, or COP26, of the United Nations Framework Convention on Climate Change. The conference aims to solidify commitments for accelerating greenhouse gas emissions reductions to meet the Paris Agreement's goals. Meanwhile, the COVID-19 pandemic revealed the many defects of the world's response system to global health threats. And there is a proposal to create a new treaty that will ensure that COVID-19 is the last pandemic of its kind. To tackle both the climate emergency and future pandemics, there is a growing recognition that what we need is a planetary health approach that brings care for people and planet together. A few reminders: this conversation will begin with an initial round of 4-minute opening statements from our panelists, to be followed by a moderated discussion. To our participants, you're invited to type in your comments and questions through the chat box, and I will be reading them to our panelists. Let me introduce to you our panel of speakers. First, we have with us the Executive Director of the Sunway Centre for Planetary Health, Tan Sri Dr. Jemilah Mahmood. We're also joined in by Dato Seri Dr. Zaini Ujang, the Secretary General for the Ministry of Environment and Water of the Government of Malaysia. Joining us from Bangkok, Thailand, is Mr. Kaveh Zahedi, the Deputy Executive Secretary of the United Nations Economic and Social Commission for Asia and the Pacific, or UNESCAP. And joining us from Geneva, Switzerland, is Dr. Maria Guevara, the International Medical Secretary of the Medecins Sans Frontières, or MSF, or Doctors Without Borders. So to Jemilah, Zaini, Kaveh, and Maria, thank you for joining us in this panel. So now let's start, and I would like to call on our first speaker, Dr. Jemilah Mahmood. Can you describe to us the current global and regional situation regarding the nexus of climate change and pandemics? And what is the significance of the planetary health approach to addressing these issues? Perhaps you can also briefly describe to us the role of the new Sunway Centre for Planetary Health. Jemilah, the microphone is yours.
Thank you very much, Renzo, and greetings, everyone. Thank you for being here. This is really our first webinar as the Sunway Centre for Planetary Health. Now, returning to your question, Renzo, the Intergovernmental Panel on Climate Change, or IPCC, in its 6th assessment report, said it best in that we are living in a state of code red for humanity. We've seen around us raging wildfires, typhoons, flooding, extreme weather events. Some of the effects of climate change are occurring at unprecedented levels. And I'm now in the UK and in Europe, and I've never experienced such a warm autumn, and late October weather before in my life. And I think that all this will only increase in severity as frequency of global temperatures and frequency as global temperatures will rise. I think our conversations on the climate crisis often depict a planet that desperately needs saving. I think this is simply not true. The planet will carry on, perhaps a little battered by the damage that we have caused. It is us, the human race, that may not. And I think that need for the planetary health approach is clear, it's simple, and it's urgent. The nexus between health and the environment is irrefutable. So large-scale infectious disease outbreaks, such as COVID-19 that we're all going through right now, and it's relentless, it's not left us, It will become more frequent as global warming releases viruses stored in permafrost or polar ice shields, or the changes changes the behavior of virus-carrying vectors like mosquitoes and others. Just yesterday in Australia, firefighters are playing a game of chess with Mother Nature, with controlled hazard reduction burns aimed to reduce the likelihood of a serious wildfire. Even so, climate change is narrowing that window for control. Human-led environmental destruction, deforestation increases our risk of zoonosis and disasters like floods and landslides. And these are not natural disasters at all. They are human-induced. And hospitals and healthcare systems make up only a small portion of human health and longevity. The larger portion, or 2/3 of health, comes from community interventions beyond health, behavior change, dietary improvements, social and environmental factors. So really the link between health and planet health is so clear. In our region, in Asia Pacific, Philippines is leading planetary health talks, thanks much of it to you too, Renzo. And the concept just starting to take root in Malaysia, but it's really promising in Malaysia because planetary health has been mentioned 7 times in the 12 Malaysia plan, a feat more advanced than many other developed countries. And as a region, we are, in the words of many disaster managers, a supermarket of disasters and disease outbreaks. And I think we are experienced. We have had the exposure, we've had the knowledge and the experience. And I think that gap in documenting that knowledge with the rest of the world is so badly needed. And we need to do it in a way that is accessible to all. Much of the time, climate scientists and health experts tend to communicate over many people's heads. I think the Sunway Centre for Planetary Health comes in here because what we want to do is to bridge that gap, translating complex research for public engagement and policy change, not just taking knowledge for the sake of knowledge. That's important, and research is very important. And the Sunway Centre for Planetary Health is really aims to be one that is will have extreme collaboration within the university itself, but also with others in the region and globally. But importantly as well, what we want to do is take this to students who will, in any discipline that they study in Sunway Centre, Sunway University, have planetary health as a mandatory module, so that when they become leaders, they will be able to better understand, better implement, and better take care of our planet, and therefore improve health conditions in our country and around the world. What we want to do as well is to engage with the public, engage with the government, so that any research, any knowledge will be translated into tangible action that we can measure and we can have impact from. So we really look forward to working with others. And I think this webinar is just a starter, and we really hope to hear from the audience as well. Thank you very much, Renzo.
Thank you very much, Jemilah, for not just giving us an overview of the myriad challenges that Asia and the Pacific is facing, from climate change and its multiple impacts all the way to the risk of future pandemics. But you also gave us a glimpse of what the new Sunway Centre plans to do, especially in terms of knowledge translation, influencing policy, and educating the next generation. So later on, I understand we have a lot of young people who are in the audience. It will be great to explore more how we can build that new generation of planetary health citizens in the region that will make sure that we are able to prevent pandemics, but also avert the climate crisis. So thank you, Jemilah. Now, we would like to listen to a more governmental perspective. And that's why we have here with us Dato Seri, Dr. Zaini Ujang from the Ministry of Environment and Water. And my question to you is, from the perspective of a national government such as Malaysia, what are the key challenges to tackling, the problems that Jemilah mentioned, climate change, preventing the future pandemics, and what are some of the future steps that governments like the Malaysian government mistake? And what are the emerging opportunities that government should embrace at national and perhaps even regional level, Southeast Asia, ASEAN, for instance? So Zaini, please, the mic is yours.
Thank you, Renzo. It takes 4 hours to answer your question. But in 4 minutes, what I can say, the challenges, I think, are very obvious. One, we have to increase understanding of the public in Malaysia to talk about planetary health, climate change and whatnot. According to the recent studies among, if I'm not mistaken, 30 countries, Malaysia scored top as far as understanding and actions related to coronavirus, COVID-19. We are 78% of the population in Malaysia are very concerned about it. But when it comes to climate change, only 1% of Malaysians take climate change as an issue in life. So we rank the last out of 30 countries, according to the study. So what I'm saying, we have to raise the understanding. And many people are confused when we talk about climate change because I think the level of political understanding and economic understanding is not there yet. People might say that, okay, this is something, an issue that people in European countries, in Australia, they are talking about it. We take note of what their concerns, but we are covered. We are here. We are in Malaysia. We don't have earthquake. We don't have typhoon. We don't have many things that other countries are doing. We don't have snow, whatever. So on top of understanding, we need to translate that understanding, whatever understanding we have, into practical and implementable actions. And this is difficult in many ways, in policy, in federal policy, in state, provincial, in states, in local governments. So that's very important for us to identify what are the major issues to be undertaken. And the third one is how can we influence lifestyle of the people so that they are willingly, proactively able to contribute for the mitigation as well as adaptation of climate change. And as far as planetary health is concerned, when we started the Ministry of Environment and Water is a new type of ministry in Malaysia. Previously, we were scattered around, so we pool all the portfolios related to environment and water in one ministry since March 2020. So we identify the major principles of the ministry must be related to planetary health. So planetary health, therefore, as a result, we find the phrase planetary health in the 12th Malaysian Plan 2021-2025 7 times, as mentioned by Jamila. So it shows that we are really serious about it and want to go to venture into planetary health in the future. So that's my 4 minutes answer. Thank you.
Thank you so much, Zaini. That was quite informative and also inspiring to hear that the Malaysian government is already taking the baby steps towards putting planetary health front and center. And actually, in the Sunway Centre, we're now, thinking maybe one of our functions is to monitor governments around the world. You know, how many prime ministers and heads of state are using planetary health messages and values in their speeches, in their pronouncements, but also beyond speeches, how many governments are actually walking the talk and putting them in their policies and programs. And later on, let's discuss more about what you mentioned as practical and implementable actions, right? How can we make the ideas and sometimes abstract ideas into reality on the ground. So thank you, Zaini, for those initial comments. Now, we've heard from 2 Malaysians, and we will be going out of Malaysia to have a more perhaps regional perspective. And that's why we have with us Kaveh Zahedi from the UNESCAP, and he's now based in Bangkok. My question to you, Kaveh, is, of course, there's no doubt that climate change and pandemics threaten human health, well-being, but also, unfortunately, derail regional and global progress towards achieving the Sustainable Development Goals, which is the centerpiece global agenda of the United Nations. Can you tell us more about UNESCAP's perspective on these interconnected issues, particularly as it relates to the SDGs, and what do you think is the way forward? So, Kaveh, thanks for joining us.
Thank you so much, Renzo, and my great appreciation to all of you at Sunway and the Sunway Centre for Planetary Health for bringing us together. I mean, it's, over the past 2 years, in a way, your question has been answered, right? All around us, over the past 2 years, we've seen what you might even call a perfect storm of disease, of disasters, and of climate change here in Asia Pacific and beyond. And even when countries had been able to successfully handle any one of these individually, most have been caught off guard with the overlapping crises. And this has very much changed, I believe, our understanding of risk and resilience in Asia Pacific, maybe in 3 ways that I could mention to you. First of all, it really is now clear that our region is faced with expanding risk and converging risks, what we call in our latest Asia Pacific disaster report, the new risk landscape or riskscape, right? And this riskscape includes extreme weather events like cyclones. It includes slow onset events like prolonged droughts, and it includes biological hazards like COVID-19. And taken all together, this converging riskscape is already costing Asia Pacific economies around $780 billion annually. And we know that this is simply just going to double. It's going to increase exponentially and actually double under the worst case climate change scenarios that I'm sure we'll talk about in a moment. So we can no longer treat disasters, disease, and climate risks individually. We need systems, and systems will need to be informed by and designed for overlaying risks, from data and risk scenarios to loss measurements and vulnerability assessments. And this is exactly what we're trying to do actually with UNESCAP's new Asia Pacific Risk and Resilience portal, to move countries in this direction. A second thing that I'd like to mention is that with this riskscape, with this riskier outlook, it is not enough to simply keep responding to shocks. We just simply cannot keep up with them. And that's why it's so vital to build resilience against overlapping crises. Now, investing in adapting to natural and biological hazards, from our estimation, would cost Asia Pacific around $270 billion a year. And that's just about 0.85% of regional GDP. So we're talking about a third of the current annual losses would be the investment needed. And so clearly being prepared is both the most effective and even the most cost-effective way to handle the expanding and overlying risks that are ahead. But building resilience has to be seen in a much broader light than it has been so far. Central to building resilience is also comprehensive and universal social protection, coupled with a resilient and accessible healthcare systems. And that's really been revealed very, very starkly by the COVID pandemic. And the current underinvestment in our region in social protection, I mean, our region invests about less than half of the global average on social protection. And what this actually means is that over half of the 4.6 billion population of our region of Asia Pacific are left to fend for themselves when disaster strikes, when pandemic strikes, whenever there is a shock. And my third and final message or takeaway at the outset is that no amount of building resilience can fully protect people from runaway climate change. We need much more ambitious and urgent climate actions. And that, of course, is going to be a centerpiece at the upcoming COP in Glasgow. what we know from our own analysis is our region is falling short of the commitments needed. Our latest analysis shows that Asia-Pacific countries, through the so-called nationally determined contributions, if we keep to what is on the table now, we're looking at an increase in emissions of well over 30% compared to 2010 by the 2030. So actually we'd be going in the wrong direction with what our countries are currently taking to Glasgow. And human and planetary health, it seems, are still secondary factors to economic growth in many of our countries, even after the COVID pandemic has really laid bare the costs of this approach in terms of inequality, in terms of vulnerability and degradation. But my final point is, not all is lost. A change of track is not beyond our reach. You know, our research shows that investing in resilience, in inclusivity, in sustainability, maybe what you would actually call planetary health, right? It would cost developing countries in Asia Pacific about $1.3 trillion a year, or in fact, less than $1 per person per day. And that brings in return social protection, better protected people, lifting millions out of poverty, and reversing this deadly trajectory on greenhouse gas emissions and climate change. Back to you.
Thank you so much, Kaveh. And just listening to your remarks, I think we are now seeing some evolving new agenda. And of course, the Sunway Centre is very much aligned with many of the messages that you've said. We would love to collaborate, for instance, with the Risk and Resilience portal that you've mentioned. But also, I think the grand challenge now is how can we turn the riskscape into a healthscape? And perhaps that is the role of planetary health in really addressing that riskscape and making sure that there's health and well-being for all. Since we're talking now about risks, including disaster risks, I just want to acknowledge in the chat box, we have a greeting from Joel Meyer. I hope I pronounced it correctly. Terima kasih to our SCPH colleagues. And they are the Pacific Disaster Center, which is an applied humanitarian center at the University of Hawaii. They are looking forward to collaborating with the Sunway Centre. So we will definitely keep you posted and reach out to you via email. And please, if you are also, to the audience, you're representing different organizations, say hello in the chat box. Let us know about your presence, and we would love to forge a good working relationship with you so that we can turn the riskscape into a healthscape. So thank you again, Kaveh. And now from Bangkok, we will fly to Geneva, but we're flying in a low carbon way because we are joining Maria Guevara from the Doctors Without Borders, MSF, is joining us virtually. And of course, Maria, you've heard already from Kaveh the many risks that not just Asia Pacific, but the world entire is really facing. And we know Doctors Without Borders have been in the front lines of addressing, the impacts of those risks for many, many decades. You have been in the front lines of humanitarian action, responding to human impacts of climate disasters, conflict, and now a global pandemic. So based on what you have seen in these settings, and perhaps you can talk from the MSF perspective, what must be done to shift our approach to humanitarian response, and instead perhaps shifting towards planetary protection, which is the title of our webinar today. So Maria Guevara, please, we would love to hear your thoughts.
Yes, thank you, Renzo, and thank you so much for this opportunity to be part of this inaugural webinar of the new Sunway Centre for Planetary Health. So first, I'm here both on a personal and professional basis as an activist for and dreamer of planetary health and the protection of this natural ecosystem that is our life support. It's really an amazing day to see this day come, and to see planetary health, which is to me an important global health discipline, gaining so much momentum globally, and having it front and center in Asia Pacific at Sunway University is a dream come true. one that I think is ever so timely as we face this new reality. So what is this new reality? You know, in 2014 West Africa outbreak of Ebola, Ebola was the poster child of zoonotic disease. Today, this poster child is COVID, of emerging infectious diseases and what lies ahead for us globally and collectively. We're living quite a novel situation for all of society, and not anymore where we as humanitarian sector have been experiencing for the last decades, and for me, in the last nearly 2 decades. It's hard to believe. But we are also seeing the glaring link between climate change and COVID. And there are two seemingly parallel yet colliding crises. And as Kaveh had already said, we are facing this perfect storms, and that's what's ahead of us. They're both to some extent unprecedented, yet running in different timescales, right? It's hard to really ignore their globality. They're not respecting borders, and they're both requiring countries to work together to find solutions collectively. Climate change has been tagged as the biggest global health threat or opportunity of the 21st century, as however you want to look at it. But if I may venture to say, today the main global health challenge is us, the human species. And I know if you just look at the 6th assessment report of the IPCC that just came out in August, the first entry is, it is unequivocal that human influence has warmed the atmosphere, ocean, and land. And if I can also quote another professor, Dr. Gluckman from University of Oakland, talking around evolutionary medicine in the Anthropocene, humans have become this niche modifiers. So to answer your question, Renzo, I'd like to highlight what I call the 3 recognitions. And this first recognition is that of human impact, should be that first step. There's no doubt that we are facing a great collision between humanity and the natural ecosystem, overwhelming our capacity to respond and adapt in real time as we wreak havoc on our environment. And being in the business of responding to humanitarian crisis, the human contribution to emergencies we face today is undeniable and may soon be untenable. And arguably, today's emergencies could be described as only one category, that is man-made disasters, where man-made selection factors are actually constantly at play. The second recognition is that negative impacts are born unevenly. So at MSF, or Doctors Without Borders, as you know, we see clearly that climate hotspots are the same as humanitarian hotspots. And these hotspots are unfortunately blind spots for the rest of the world. And the vulnerability and responsibility are unequally distributed with regards to climate change. The current COVID pandemic highlights well this endemic of social inequity, inequality, and injustice. And it's showing us in a full frontal way what lies ahead with climate change, asking us in no uncertain terms, are we ready? So their sense of urgency is very much front and center. And for years, what our teams at MSF have been witnessing and responding to across the world are these increased transmissions of infectious diseases such as malaria, dengue, cholera, water scarcity, food insecurity, leading to malnutrition, the impacts of heat exposure, including acute dehydration, leading to acute kidney failure or heat stroke, or exacerbation of cardiovascular conditions. And we know that climate change has been acting as a threat multiplier of violence, forced displacement, psychosocial ill health, and increasing further the vulnerability of populations. For the third recognition, I would highlight responsibility. From the MSF perspective, the mitigation and adaptation are actually 2 sides of the same coin. And in the spirit of the do no harm principle, we feel this social responsibility to take serious consideration of the way we are organized and the way we manage our footprint in terms of growth and modus operandi. On this thread, it's also why the planetary health lens makes sense, as it highlights that human responsibility in causing the decline in the natural ecosystem as we approach the planetary boundaries of the processes as climate change, land system change, biodiversity loss, global pollution, etc. It emphasizes that real urgency, the need to act now, responsibly, and definitively, on this issue. It's requiring us to look at the full system that needs to change politically, economically, and socially. It is our collective responsibility to not only be the cause, but the solution we require. It's not only a public health priority, but an actual moral imperative. I think I'll stop there. Thank you again.
Thank you very much, Maria. And you know what you just did is, I think you've brought us back to the essentials, right? You know, what's really at the heart of these challenges, this risk, these problems that we're talking about. And you highlighted that, you know, that's why it's an anthropogenic problem, right? You know, we caused it, and then now it's getting back at us, you know, the human impacts. And then thanks for reminding us about the principle of equity and justice, that you know, these impacts are unevenly distributed across society, and that has to be central to our planetary health action. And you highlighted, you know, that you know, part of this equity narrative, or lack thereof, is there are hot spots and blind spots. And you know, I love playing with words. So I think the challenge is how we can turn the hot spots and the blind spots into health spots and hope spots, right? And so now we have to find those hot spots in that riskscape and apply a planetary health approach for the healing of our societies and the world entire. So thank you, Maria, for those inspiring words. And now we will shift to a more interactive conversation. We've heard from our four inspiring leaders from different organizations, different perspectives, but also converging towards some key messages around planetary health and planetary protection. So what I'm going to do is, I have some questions already prepared in advance. I will also be reacting, and I've been doing that already, to some of the things that you've already said. But also, I would encourage our participants, the ones in the audience, to please type in your questions and comments. You know, we have 4 panelists here and 1 moderator, and I believe you are the 5th panelist, our audience. And so you should be part of this conversation. And I'm already seeing some very, very important questions from the audience. And let me start by, you know, we've talked about, you know, COP26. You know, Kaveh reminded us that, yes, we need to build resilience, reduce risks, but we need to really demand for the acceleration of decarbonization, right, and mitigation. And that is really the central issue in the upcoming COP26. You know, they're talking about the Paris rule book or playbook, and they're also demanding countries to become even much more ambitious when it comes to the nationally determined contributions that they've submitted to the UNFCCC. So what are your hopes that COP26 will actually deliver? I know Zaini is attending COP26. Perhaps Maria is joining as well, albeit remotely. I don't know, you tell us. But what are your hopes when it comes to the decarbonization action plan of the world that will come out of COP26? And you know, if whether it's optimistic or pessimistic, what should we do else outside of the COP26 regime to make sure that we meet the Paris goals? Who would like to start the ball rolling? And I hope that's not a very difficult question to ask. Jamila, I see you on mute, so that's a signal, please.
No, I was going to say that I think Zaini and Maria will be there physically. I'll be joining remotely. But, you know, with all these big meetings, you and I know a lot is being said, right? A lot of commitments. And, you know, the eternal optimist in me feels that maybe people have woken up to the fact that we really can't waste any time. I mean, we also just had the World Health Summit in Berlin, where, you know, for the first time, sort of planetary health discussions were had. Still not enough, but certainly, you know, already starting to begin. But, you know, for those who are attending and even those who are not attending, I think it's up to us. You know, if we created the problem as human beings, we need to put pressure on participants, on governments, on corporations, on their responsibility to ensure that we don't, go down this horrible spiral that, we seem to be heading towards, downwards. So like all COPs and all major conferences, there's a lot of verbal commitments. I think what we want to see now much more is action. And I think this is where, how do we develop a global accountability mechanism towards, holding those who made these pledges accountable? So I think these will be the big questions that we need to ask.
Thanks, Jemilah. Any other thoughts? And I know Zaini already unmuted his mic. Please.
Thank you, Renzo, for that question. Well, I mean, who are the people attending COPs? Typically, they are politicians. We know that politicians trying to behave themselves so that they are generally seen as a leader of the countries. So the message that we must send to all leaders are, I think the first one are the underlying drivers of all this. And according to Planetary Health framework, there are three major drivers. One is consumption, overconsumption, or we consume for nothing. And second is demographic shifts. And the third one is technology. So I found that in many discussions that we had pre-COP discussion, people are concentrating too much on technology. I mean, the fact that Tesla as an automotive, I'm not criticizing, I just mentioned the fact, a company called Tesla that yesterday became the highlight of all major newspapers in the world, reaching the point exceeding $1 trillion USD, primarily because people think that this will be the technology for the future. But we didn't discuss about the consumption. We didn't discuss about why we need to travel if we can do it using, say, for example, internet, webinar and whatnot, instead of traveling. Why? That's the kind of discussion that I would like people to understand. Therefore, when you ask the first question, the main challenges, I think, is understanding. And then from that understanding, we translate it to action. Yeah, so therefore, when Tan Sri Jamila started to talk about planetary health, I said, yes, that's the point, because in my books that I have written in 2018, Echo Shift, the principle of planetary health is there. We discuss as underlying principles of many environmental work that we have to do in the future. That's number one, underlying drivers. The second one is ecological drivers. Ecological drivers could be climate change, global pollution, what else we have here? Say, for example, resource scarcity and whatnot. So often we are not putting that into perspective. So what planetary health brings to us is to put them into perspective. So what is your main focus? Which angles that you want to overcome this issue? So when we travel to COP, I advise many of my colleagues for us to understand the whole perspective. Often many people travel to that kind of conferences. Number one, they want to show off. Number two, they want to bargain. Number three, they want to get something. So these are the major concerns of some people traveling to this kind of conferences. But if we go beyond that, what else we can do, as you mentioned, beyond Paris Agreement, is for us to have a real commitment. I mean, we are genuine. We are not just going there because of political reason. I'm so sorry. Thank you.
Thank you so much, Zaini. And, listening to you, I think you're very well prepared for the upcoming COP, because you already know what to anticipate, the bargaining and the asking and the negotiations. But I'm particularly intrigued when you said that we're not talking very much about consumption. I think all the attention is focused on the molecule, the CO2 and methane, but not very much on, where they're coming from, right? And that's from our patterns of consumption and production. And, the Paris Agreement and all the other associated instruments are not, are kind of quiet when it comes to those fundamental, issues. And so maybe some of you have other thoughts regarding COP26, consumption, etc. Maria, I'm seeing you feeling very excited.
Exactly. It's because actually I wanted to go on that concept that Dato Zaini has already mentioned. I'm less optimistic as Jemilah, only because if there's all these document leaks now that's coming out highlighting that different states are requesting changes in the IPCC reports just so the wording is different with regards to the use of fossil fuels or even meat, eating meat, etc. And it has to do with the consumption aspects, right? So it's about the business rather than actual trying to address this issue. There is no shortcut to climate change. We need to make real changes, and that comes from having bold, courageous leadership. And happy to know that Dr. Zaini is going to be there on behalf of the Malaysian government to really show what needs to happen, what shift needs to happen. And we as the individuals also have a role because we are the consumers. And so we need to also make those changes. And so as the CSO that will be there as one of the civil society, hopefully we will show that. On an individual basis, I need to also look at my own practice as well. But I think it's, we all have an individual to the institutional, to the governmental role in making this reality happen.
Right, Maria. And yes, to the individual responsibility, but I think there has to be some system redesign that needs to happen as well. And by the way, one of the 5 priority themes of the Sunway Centre for Planetary Health is around imagining or redesigning fair economy. So we're not talking very much about the economy. And, because Kaveh is from the UNESCAP, E stands for economic, perhaps you have some thoughts around, COP26, consumption, the economy, and how can we up the ambition of not just COP26, but the entire global action against climate change. Kaveh, please.
Yeah, well, I mean, that's a big question. It seems to me, amongst our group, being a little bit informal, it seems to be that so many countries are going to COP thinking that somehow they can outsmart nature. That if they get some sort of exemption, if they put in some sort of inadequate NDC that includes using coal for the next 50 years, that somehow it's a win. But it isn't. I mean, we've had such clarity from the IPCC in terms of the direction that we're heading and the kind of world that is awaiting us if we can continue on this current trajectory. And I think, I think the UN Secretary General has run out of adjectives to use anymore in terms of how alarming this situation is. But certainly going in, I know that just yesterday or the day before, when UNEP launched its gap report, that the Secretary General said that so far parties to the Paris Agreement are utterly failing to keep this target within reach. So if that's the case, what can we do? And I think our region is not absolved, right? We cannot go in to this meeting assuming that our region can await better outcomes and follow others. It is, after all, our region that is emitting over 50% of greenhouse gas emissions. And so there is some responsibility here. It is our region or countries within our region that are stubbornly clinging on to coal, right? So much of that responsibility sits with our region. Many countries still in our region have not ended subsidies for fossil fuels or for polluting industries, and very few have put a price on carbon. So I think there's still a lot of work, Renzo, to be done, but we are seeing good movement it's just a little bit niche still. I mean, when it comes to climate finance, which is such a sticking point in this in the climate discussions, right? That mythical 100 billion that never seems to appear. But that's the floor, it's not the ceiling. So much more is needed. And we're seeing movement, we're seeing innovative finance instruments, including in our region, beginning to gain momentum. The green bonds, the debt for climate swaps, including for Pacific countries, etc. And I hope that these will help us get to not to planetary tipping points, but to economic tipping points that will take our development in a different direction. But I'm so delighted to hear you know, that what Dr. Zaini also put on the table, that we cannot have this discussion without talking about demography. We cannot have this discussion without talking about consumption. It is not some sort of anti-development rhetoric. It is just the right discussion that needs to be had. And unfortunately, we need all of it at the same time, right? We need a circular economy. We need that movement towards a green economy. We need green decarbonization by the middle of the century with very clear targets, milestones that will take us there. And we need to look at technology. We cannot, in a way, afford not to go down any of these avenues. And I'm not sure COP really lends itself to that. So often it degenerates into process, but it is a moment of coming together that I hope once again serves as another wake-up call and helps to jolt us back on the right pathway.
Thank you very much, Kaveh. And when you were mentioning that, you know, that's not anti-development, you know, I think, you know, talking about these very critical issues and addressing them are pro-development, pro-human rights, pro-equity. Because if we improve the climate, we improve the economy, we address poverty, then it will definitely uplift many of you know, the citizens, not just of Asia Pacific, but the world entire, who have been left in the margins. And you know, since we're still here in the discussion around COP26 and, you know, the level of ambition, there's actually one question from Philip Columb, and I think it's addressed specifically to Zaini. What are the indicators of Malaysia's current level of ambition on climate? I know that the 12th Malaysia Plan has laid out a very ambitious net zero by 2050 plan, but how is Malaysia planning to achieve that and to also monitor progress? Zaini, please.
Okay, I beg to differ from your statement just now. We plan to achieve net zero greenhouse gases emission the earliest by 2050. Yeah, it's not by 2050. The paperwork to be completed next year by 2022 to outline the strategies and how we achieve that. But the principle is already there. Then all government agencies must think collectively how to achieve that. But I give you an example of a more practical thing. By 2030, all government fleets will be non-internal combustion engines. This is, for example, so that's very tangible. I have been working with Ministry of Finance recently. How can we move forward to achieve that? Whether we want to have hydrogen car or electric car, something like that. Hydrogen lorries or electric lorries. We are now talking about that because we have to start by next year. Then it is very important. Prime Minister has already instructed that he and all cabinet ministers will use non-ICE vehicles by next year. So we have to provide for that. So indirectly, what we are saying, we put forward the agenda so that not only a policy, but also some practical thing that we would like to implement. Yeah, and the third important points that I would like to address. This morning I had discussion as well with my team. In all engineering design, we must provide for climate change factor, and this is big. Say for example, in the past we have only some percentage for, say for example, contingency something. it's about 10 to 15%. But now, contingency plus climate change factor, especially related to water infrastructures or environmental services. So this is something big that we have to start by next year. Fortunately, our guys at the National Water Research Centre Malaysia is already started doing that many years ago. I'm very sure not for fun, because they are researchers, they have to do something, and we want to adopt that. Yeah. The only thing that we have to do is from assessment report 5 that they have completed, we have to work on assessment report 6 as published by IPCC in terms of severity of say, for example, climate change effect to Malaysia. So this is what we are doing practically. So I'm not saying that we just have a nice policy to be announced by Prime Minister or by ministers in Parliament next week. There'll be 5 questions on climate change in Parliament of Malaysia. So I had long discussion with my teams this morning, because next week I'm traveling to Glasgow. So Prime Minister will answer that question in Parliament. 5 questions, all of them about climate change.
Great, great. And thank you for sharing some of the concrete initiatives that the Malaysian government is now starting to enforce, to implement. And I think other neighboring countries have so much to learn from the Malaysian experience. And the Sunway Centre hopes to act as a convener and as a sharer of knowledge and good practices. So definitely we would love to work with CASA on this.
I forgot something. It's very important.
Please. Sure.
By next year, Q3, we will be starting our carbon market. And this is to be conducted by Bursa Malaysia. So we have completed our initial discussion, and moving forward, you can have carbon trading in Malaysia.
Awesome. Thank you, Zaini. I'm going to try to inject more questions from our audience, and I really am thrilled that our audience is asking a lot of questions, sharing their comments. We have one, since we're still in the subject of greenhouse gas emissions reduction. Abdullah Azam Mohammed Norman is asking, majority of greenhouse gas emissions is contributed by large corporations, which are usually listed in the stock market, while activities of these large corporations can be regulated through listing requirements by putting emphasis on sustainability reporting. Changes made by these corporations are arguably made in order to meet listing requirements and manage brand reputation. So I guess the gist of the question or the comment is, how can we enhance responsibility among large corporations that are part of this so to speak, crime of climate change, emitting a lot of greenhouse gases into the atmosphere, making the climate more unstable. So any thoughts on engaging with the private sector and corporations, whether from a Malaysian perspective or from a more global perspective? Jemilah, please.
Yeah, I think Zaini can also contribute to this, but it's certainly in Malaysia, the stock exchange or Bursa Malaysia is very committed to this. The bank as well, to really weave in what they call the ESG factors, environment, social, and good governance, where if banks stop giving loans to those who are climate polluters, then that's a very important step. But also many of the larger corporations are now making commitments towards zero carbon and so on and so forth. So I think this cannot come from just the fact that they want to do good. No, this must come from societal pressure, right? I keep repeating the story, and I actually said it during quite a big meeting with the stock exchange, that when straws were changed from plastic to metal to paper to edible, it's not because they thought it was a good thing to do, but because everyone associated plastic straws with turtles with straws sticking in their nose, right? And the amount of pain and blood that was shed, trying to extract this plastic straw. So it's about reputational risk as well. So it would be fantastic, that we have in every corporation, not just a P&L, but also not just a profit and loss ledger, right? That means what is your environmental impact? How do you name and shame, corporations that do this? But I also don't want to, villainize corporations. I think corporations are actually doing much more than government sometimes. There are many corporations that are really, really committed. I'm not saying all, but it also has to be us. We are the consumers. If we don't consume the things that corporations are producing, and if we don't alter our behaviors and also put pressure on our governments to take these things seriously, then there's a problem. For Malaysia, it's very exciting because we have a new opportunity with those 18 and above to be able to vote now. And they will exercise their votes in the right way. Young people are much more aware and committed to this. And I think this is where we must engage with young people.
Thank you very much, Jemilah. And the others might have additional remarks. I'm seeing Maria. I'll just add one related question from Yasmin Mahmood, who is a very dear friend of the center. Do you think there should be a stronger focus also on driving change through reimagining and redesigning the capital market? So it's not just holding corporations accountable, but actually changing the rules of the game altogether. So maybe, Maria, you have some thoughts on that. Yeah.
I'll try to weave my answer from the previous to this. But one of the things in the humanitarian sector, and at least from the MSF perspective, is we recognize ourselves as a huge consumer, especially for supply. And one of the things we've been looking at, in which we know that Red Cross as an International Committee of the Red Cross have been looking at the sustainable supply chain for the last decade, looking at it from the economic efficiency, social equity, environmental preservation aspect, and as a responsible consumer, engaging with the private organization or the producer or the manufacturer where we are buying these goods, to work together on designing more ecologically friendly packaging, or or even using materials that are more ecologically sustainable. So we have a role to be responsible consumers as well, knowing the large capacity or as the consumption that we use just to carry out humanitarian actions. So I think just on the concept of redesign, it's being part of that design. And then the willingness from organizations like us, as the individual as well, but also from the corporate to bring in, which reminds me of some of the actions that we've done from responding to Ebola, but also responding to COVID, is how we build a link and the bridge to the community in co-designing the response together. And that's how we were able to make sure that people came to the Ebola treatment center rather than burning and attacking them. So this kind of bridging is important to do.
Thank you, Maria. Any other thoughts regarding working with the corporates, but also redesigning the economy altogether? I think I see you, Kaveh, unmute. Is that a signal?
Sure. Let me try. I mean, obviously, it's very hard to talk about corporates as a sort of monolithic blob out there, right? Or business as a whole. And you do have some businesses that have been absolute leaders way ahead of governments, right? In trying to decarbonize their own operations. They're some of the household names. Some of them have done it because it's the right thing to do, and some of it have done it simply because of risk, right? Whether it's reputational risk or climate risk, frankly, it doesn't matter as long as they're moving in the right direction. For our part, we have this UNESCAP Sustainable Business Network, and what they're focusing on is building for themselves together what they call a Green Deal for business. So I think the big companies, many big companies are moving in this direction. But you know, in our region, Asia Pacific, especially in Southeast Asia, the backbone of the economy are small and medium enterprises, right? Some of whom can't afford to go down this path, right? And this is where that leadership that Dr. Zaini was mentioning is so important. That the leadership that comes, the markets that are built, the prices that are driven down by leadership from the government through its procurement, for example, or by big companies through their supply chains. It makes a huge difference. You know, what we haven't unfortunately seen is, and the very best opportunity for this leadership, right, for really changing the trajectory, of course, was the COVID investments, right? The recovery, COVID recovery, very little of which went towards this, showing this kind of leadership. Maybe 10, 20% of it was for green. The vast majority was for perpetuating, you know, the brown economy of yesterday. So we've missed a little bit the opportunity for that spark of leadership that can change markets and then can help with that realignment that one of the questioners was saying, realignment of the capital markets in particular with our aspirations. Right now, we're working against each other, right? Investing in one thing and aspiring to something else. And if we work with the financial authorities, the financial regulators, the central banks, and there's a lot of momentum in this already, I think there is that calibration going on and we will get it. But let's not forget the smaller players, as I say, the micro, small, medium enterprises. And I think that's where many of us are trying to facilitate a change in a very difficult business environment post-COVID.
Thank you very much, Kaveh. And you know, when you reminded us about the role of small, medium enterprises, I just got reminded of our initial talks right now with the Sunway University Business School, because we are exploring some projects related to entrepreneurship and innovation for planetary health. What is the role of the next generation of businesses, big or small, to help us in the planetary healing of the world? And so watch out for that space. And if you're in this arena of innovation, entrepreneurship, business, and you want to do good, and you want to do right, please, we will be happy to collaborate. And so, you know, we've talked about the economy, we've talked about entrepreneurship, we've talked about what big corporations or small enterprises can do. I want to shift gears because we only have around 28 minutes, although there's plenty to talk about within that time period. And there are some questions related to young people, the next generation. I think we have to also acknowledge that we don't have a young person right now in this panel. And of course, in our future conversations, we'll make sure that there's always a young person's voice. And although, Jemilah, if you remember, our first ever event was not this one, but our youth town hall, which we organized in August. So we had a very rich conversation with young people from Southeast Asia, not just about their, their diagnosis of the problems, but also their aspirations for the future. So there are several questions about young people. I'll just read some of them. One question is from, again, Yasmin Mahmood. Happy to see Sunway CPH focusing on educating the next generation, of course, because we are embedded in Sunway University. What is the state of awareness and commitment of Malaysia's and the region's young people towards planetary health? How can this be further harnessed and organized to accelerate its impact towards driving change? Jemilah, you might have some thoughts about young people.
Yeah, I think just to share that, when we were beginning with our center, and I put out a tweet, I want to talk to young people, and I was amazed at how many young people reached out. And therefore, our first ever engagement was with the young people in a town hall. And I must say it was so inspiring because they were excited, they were committed, they wanted to see change. Now, our role is to try and harness that energy and turn that into something concrete, but also influence other academic institutions to do the same. So one of the ideas we are having is to really have almost like a Fridays for the Future, where we want to spotlight what young people are doing. You know, we need to show the world that actually a lot of them are already doing amazing things. You know, how do we encourage them? How do we learn from young people? I think there'll be a lot of learning from the government and private sector on what young people are doing. The second thing that I wanted to say is just to build on the small medium enterprise issue, is that, you know, you're absolutely right, Kaveh. You know, how do we also provide mentorship, guidance, incentives to small medium enterprise so that they can thrive in a way that also protects planetary health. So I think, you know, this is something we as a center would love to engage with the government of Malaysia first, for example, with the stock exchange, with, you know, small SME Corp and others, to see how do we influence that. But I must say that one thing which Dr. Zaini didn't mention, which we are very grateful for, is when we were launching the vaccination program in Malaysia, I kind of nudged Zaini and said, help me, and let's go together and push for a green vaccination program. I think Malaysia is probably the only country that has a documented green vaccination program, which maybe Zaini can also expand. But first of all, to say that, you know, for a 1-year period of the vaccine rollout, we hope to be carbon neutral, and that means a lot of offsetting. And I think even if anything, it's very symbolic, because it does, you know, categorically link what is primarily a health ministry initiative, a vaccine rollout, to an environmental protection issue. So I'm pretty proud of that. So I wanted to say it.
Right. Zaini, do you want to add?
So we started with Minister KJ, Khairi Jamaluddin. He is now Vice President of WHO. He's just recently appointed, I think elected, I think a few minutes ago. He's very close friend to Tan Sri Jemilah. So we started with Green Southeast Asia Games in 2017. So I was the chairman of the technical committee on green initiative. And then we continue with green vaccination. In order to become green, there are at least 2 ways to do it. One is to reduce the, waste and wastages, reduce, say for example, solid waste, whatever, consumption, whatnot. The second one is to reduce greenhouse gases. There are 2 ways to do it. One, by using, say for example, electric car, bicycles and whatnot. So during SEA Games 2017, you can only use bicycle or walking to the SEA Game complexes. There are many complexes. And the third one, the second one is offsetting the emission that you cannot reduce by planting trees. So for COVID-19 vaccination, we have calculated so far we are calculating still, it's about 1.2 million trees to be planted to date. Probably there will be more because we are going to have a third dose in the near future. And then children in Malaysia is also going to be vaccinated. To date, if I'm not mistaken, Tan Sri Jamila, we have more than 98% adult population in Malaysia being vaccinated, double dose. Yeah, and the more means the more trees we have to plant to offset the processes for the vaccination to take place. And then by there are calculations to it, and then we offset with number of trees to be planted. Yeah.
Yep. Thank you so much, Zaini and Jemilah, for this example. And I think, you know, I mean, unfortunately, the pandemic is far from over. And I think it's never too late for countries to actually copy what Malaysia did in terms of the green vaccination program campaign. And there's actually one question in relation to this from Shiwei Uwe. What do you think is the role of medical students and perhaps the entire health sector, not just in Malaysia, but around the world in advocating for climate action. And maybe Maria, you have some thoughts because you've been doing a lot of great stuff in MSF, in greening MSF.
Yes, no, actually, I wanted to, again, I'll try to bridge the different questions that's come up and the answers I had in mind. Just wanted to go back just a bit on the youth aspects. It's, you know, they are our future, and I think inherently they already know. I mean, for any change, you need this critical mass, and they are, you know, quite quick as innovators to really take on changes and influencing already within their families, but into, you know, into the public, and very agile in the digital world. And we know that a lot of social changes are happening on this stage. But also because they're our future workforce, it's very great to see that planetary health is front and center within Sunway University, because that's where you starts to become part of who you are as an individual through your education, through that awareness. And as a medical humanitarian organization, as a doctor myself, I wish I had planetary health in my education way back when. But now there is this opportunity, and it's very important to have this integrated into our medical education, because it is about health, and not only human health, but planet health, and that those are interconnected and cannot be separated. So it's nice to see that it's starting from not just a medical student stage, but also from the university stage. The other is, you know, and I think from MSF's perspective, that connectivity is super important. And it's easy to already know that within our force as an institution, when they come to work with us, it's already part and parcel of who they are. And they push you as an institution to do better, to try to be more sustainable, to be ecologically responsible. So I think it's quite interesting to use that force through previous education to trainings. And the last thing is, if what we're seeing from COVID is the voice of that medics and health workers have, and I think we need to, I think I've quoted this before, but there are many surveys in the past, and if I can just ring out Dr. Courtney Howard, who was used to say, who do people listen to? It's usually the health workers and not necessarily always the politician. And I think if we have this solid training, knowledge base within our health workers, they can be that voice multiplier as much as the responders to the crisis.
Thank you very much, Maria, for highlighting the power of the voice of the health sector, and linking it back to COP. COP26 is actually the first COP where there is a very strong emphasis on health. There's a COP26 health program. The WHO has led the efforts of the global health sector. There's so many initiatives that will be launched, including the Race to Zero campaign. Several hospitals around the world, including Sunway Medical Center Velocity, made a commitment to become net zero by 2050. And we're, of course, going to recruit more hospitals across the region to be part of that program. I actually want to acknowledge the presence of some of our friends from Healthcare Without Harm, who's in the audience, who is a partner of the Sunway Centre in bringing sustainability into healthcare in Malaysia and across the region. Shiwei Oi also messaged in the chat box, and she's sharing that some initiatives from the medical student side on how to incorporate climate action into healthcare. So I think the future is bright. We are now seeing a new generation of planetary health physicians on the rise that will transform healthcare, but also transform broader society. There are other questions, and we only have around 15 minutes left, so I'll try to be more efficient, and we'll just some of the questions are all interconnected, so I'll just pick and choose the ones that are quite perhaps not covered yet. And from Lynn Chua, Salamat Sehatera, thank you to all the speakers. She is asking about the inclusion of indigenous groups in the planetary health discourse, the voices and wisdoms of various indigenous groups who are the original stewards of our ecosystem. So how can we make sure that in our transdisciplinary planetary health approach, the different ways of knowing and seeing are included? Jemilah, do you want to respond to that, and maybe the others? Go ahead.
I got very excited when I saw that question, because it is certainly something we want to focus on. You know, there's a lot of learning that we can gain from indigenous groups. In fact, we're even looking for an indigenous person to represent our advisory. I think this is important, but also I think the great advantage of the Sunway Centre of Planetary Health is we're based in Asia, and you know, we hope to have opportunities in future where we can have sort of summer programs where we can actually go into indigenous.
We have summer all the way.
Right, and learn from them, right? And also, just to give you as a side, if you look at health, indigenous people who are living deep in the interior have better health outcomes than those on the fringes, and much better, and those on the fringes have much better than those who have been urbanized. So there's a lot that, you know, we can actually gather and learn from this. So that's a really important point.
Thanks, Jemilah. And also, in addition to indigenous perspectives, I think it's high time for Asian perspectives to really help advance planetary health. So, you know, Jemilah and I and other colleagues have actually published early this year a commentary in the Lancet Planetary Health about the contributions of Islam to planetary health. And I think this is one arena that the Sunway Centre also would like to really, you know, enrich. You know, what is the contribution of Buddhism and Hinduism and all the religions of Asia in terms of, you know, even redesigning the economy, rearranging our relationship with Mother Earth. So there's so much wisdom from all of these traditions if we just, you know, seek out for knowledge and listen to these voices. We have a question, but it came from an anonymous attendee. Malaysia is a big palm oil producer that generates a lot of greenhouse gases. How strong is the political will of Malaysia to fight climate change, especially because the economy's interest is at stake with regards to this issue? Maybe that's a question for our Malaysian colleagues, Zaini and Jemilah. Zaini?
Yeah, this is a question that we are also seriously considering on the way forward in Malaysia. But I don't want to give my personal comment on it because I've been in this business for the past 30 years. You can see my papers. I think 50% of my papers that I've written technically were published around this how to make palm oil more sustainable, reducing the environmental impact. But from social point of view, socio-economic point of view, we have to realize that through plantation of rubber and palm oil helps, I think, poor Malaysian to get jobs and earn living. I'm not saying it is lucrative income for smallholders, but in general, say for example, in my hometown, my family members in my hometown, they are mainly growing palm oil and rubber, and these are the main source of income. Yeah. So to say that they cannot grow palm oil, you have to give some justification for that. And what the alternatives we have? Yeah.
Thank you so much, Zaini.
Question. Yeah.
Yes, it is. It is not. And I think what the Sunway Centre can do is to actually provide a platform for these conversations. And we'll try to be, you know, as inclusive and consultative so we can really find, you know, the right solutions. Any others who, Jemilah, do you have some thoughts on that, or you don't have? Let me go to the next question. And this came from our friend Adelina Kamal, who was the executive director of the ASEAN Humanitarian, you know, Center. And her question is something related to global governance. Should we have a global governance instrument that will serve as a global watchdog to monitor compliance and settle disputes? She gave some examples. When Indonesia cut the agreement with Norway, should have there been an instrument that will monitor or investigate? Or for example, when the US walked away from the Paris Agreement, although now they also just joined again. So, you know, how can, I guess the broader question is, how can we ensure that we have strong accountability mechanisms? And I think that is what Jemilah was referring to a while ago when we were talking about COP26. Any thoughts?
Maybe Kaveh can help me as well, and Maria. I think that, you know, you and I know when it comes to global mechanisms and the multilateral system, at the end of the day, it's always a negotiation. And member states themselves, you know, will probably shoot it down. But I mean, we see this. I mean, look at the COVID-19, right? We've been pushing for a pandemic treaty, you know, and the excuse given back is, oh, let's strengthen IHR, international health regulations. So the whole issue around compliance is always difficult. It's okay to do benchmarks or standards, but when it comes to compliance, it's an issue. But it doesn't mean we have to stop. I think that the more voices raised on this, you know, we just need to keep doing this. And while there may be formal accountability mechanisms or compliance mechanisms, there can also equally be very powerful informal mechanisms from civil society, from the public, and so on and so forth.
Thank you, Jemilah. And yes, I think the Sunway Centre is very committed in working with civil society, creating the movement that will add pressure to governments, corporations, and every sector as well. Kaveh, please.
I really think, I mean, it's a tough question, but I think Dr. Jemilah gave exactly the right answer, because we've got to be realistic about what can and can't be achieved by mega governance mechanisms, global ones, right? And I'm not sure whether really there is the appetite out there to have any kind of major binding mechanism that is so overarching that it can deal with climate change and deforestation and everything else. I hope there is, and I hope eventually that will come about. But what we've seen is, and I hope you've seen it as well, recently out of the General Assembly and pushed very much by the UN Secretary General, he's come up with something else that he referred to as a common agenda, right? And at the heart of this common agenda is exactly what Dr. Jemilah was mentioning. It's a move towards what he has called networked multilateralism, which means we don't put all our eggs in one basket, expecting somehow miraculously for governments to come up with binding agreements that will bind themselves to politically unappetizing futures, right? We need networked multilateralism that is built around very specific kind of issues, coalitions of the willing that bring in the businesses that we talked about earlier, the indigenous groups that we talked about earlier, the youth that we talked about earlier, so they are part of the decision-making process. And I think that is indeed, as Dr. Jemilah said, an absolutely vital avenue to explore. Renzo, let me just while I have the mic, you know, one of the challenges, and Dr. Zaini mentioned this, is that for about, you know, the past 5 decades, the countries of Asia Pacific have been using, not just Asia Pacific, but the countries of Asia Pacific inclusive have been using the wrong metric for progress, right? It's all been about economic growth and GDP. And this has left a region with extraordinarily high inequality, right? Inequality across the board, not just of income, but of opportunities as well, which is so vital for a region with youth in the way that we have it. It's left our region extremely vulnerable, as we've seen with COVID, and it's left unprecedented environmental degradation that has planetary implications. And we cannot continue to perpetuate that kind of economic metric if we indeed want to have a different outcome. It's like the colleague was saying, if the capital markets are pulling in one direction and you keep talking about a different future, how do these two come together? And our growth metrics are one of those. And we thought we'd gotten over it with the Sustainable Development Goals. At last, a metric in a way that can measure more holistically real progress. But even there, our region is not on track to achieve a single SDG by 2030, not a single one. And so we can conclude from that that misalignment in our economy is still in place. The reality that Dr. Zaini mentioned is there. We have high levels of poverty. How do you deal with that? How do you pull the millions that need to be pulled out of poverty? How do you provide electricity to the millions who are still without electricity in our region, right? But how do you do that in a way that doesn't entirely undermine your own future as a country or as a region, or in this case, as a globe? And we haven't resolved that yet.
Powerful remarks. And, you remind me of, one framework that Jamila and I are big fans of, the donut economy. Kate Rayworth will always say GDP should not be the metric. It's lives, improve and potentials that have been realized, but also planetary boundaries that have not been breached. And we will definitely organize a future webinar focusing on the donut economy. Is that the future economy for Asia? Maria Guevara, I see you raise your hand.
Yeah, no, I mean, I mean, not that I have anything to say necessarily about governance and accountability, but mainly the fact that if we were to look at planetary health and the way it was envisioned, at least in its Sentinel Commission, it's about the failures of the society, right? It's on the imagination failures and knowledge failures and governance failures. And if I were to go back on the question around indigenous population, they hold the basics, right? And it's really how do we work with going back to these basics and understanding where we are? And that's the thread we should actually go for. And just highlighting on that is, this network approach is very interesting. And there are many actors or many organizations that are looking at it from those lenses. Health in Harmony has an actual project where they save forests. So if we were to look at the plantation questions, where they maintain the connection and relationship with the indigenous population and how they find a way to actually make it work, where there's still some business, but it's still also maintaining health. And there are those elements that we can learn from the indigenous population this way. But more on the governance failure is it's the question of, to me, responsibility, going back to the recognitions that I had mentioned, is two sides of the same coin, right? Responsibility and accountability. And if you have the right compass of what's driving you, then maybe that is where we need to go back into this state of equilibrium that we need to remember. It's really interesting. I was just listening to George Monbiot's idea on that we are a society of altruists. We're just governed by psychopaths. So how do we bring back that altruistic kind of connectivity, a participatory kind of network democracy that we need to bring to the table to ensure that we are each accountable to ourselves and to each other. Yep. I don't have the answers, but here we are.
And we will not be able to answer all the questions in a 1.5 hour webinar, but you said we need a new compass. And I think that new compass is planetary health, right? This new way of thinking and our approach that really brings together the care for the health of people and the care for the health of the planet as well. And, just listening to all of you, there's so many questions, and, there are new concepts that are arising: planetary health diplomacy, planetary health governance, planetary health economics. And these are just some of the important themes that the Sunway Centre for Planetary Health will try to answer in the coming years, but also try to make happen, right? Because we always want to see ourselves as not just a think tank, but a think and do tank embedded in Sunway University. I'll give you all the chance to give one sentence, final remarks. And I guess the question that I want to ask to you is, what is your vision for a post-COVID, post-carbon, and post-SDG future? Anyone who would like to start? Oh, well, I'll ask Zaini first because his microphone is already unmuted.
Thank you. First of all, I think we should be positive moving forward. Despite all kind of challenges, we are still here, we still survive. And not only that, for those who have positive mindset, I think it is easier for us to talk to them to move forward. Thank you, and we move forward with planetary health principles, whatever you want to call it.
Thank you, Zaini. Let's give the mic to Kaveh.
How do you follow that? I can't say we shouldn't be positive, right? No, of course we should. Look, the truth is, you know, it's 2 steps forward, 1 step back, and we see that. But we are evolving all the time. You know, maybe the concept of planetary health is one that will really resonate in a way that net zero didn't. Maybe it's because of air pollution that the countries will act rather than because of GHG reduction. Maybe it's because of COVID. You know, all of these are potential trigger points, and we see so much going on, whether it's in education, whether it's in business, or whether it's in the government sphere, that I think does bring hope, as Dr. Zaini said, and we'd be really happy to work with you, of course, Dr. Jamila, to work with the colleagues who've listened to us today, because we don't have the solutions, right, and we don't have that silver bullet, but it's these cooperations that will, I hope, come out of encounters like this that will bring us parts of those solutions. And I really thank you for bringing us together today.
Thank you, Kaveh. And we'll make sure we turn the riskscape into a healthscape through planetary health. Maria Guevara.
Yeah, so and hopefully we'll do that with turn hotspots into hope spots. I just, as far as the framing, and just wanted to mention another metric we should probably need to consider is the gross national happiness, which Bhutan is using, and maybe there we can find the happy well-being that we need to collectively as a human species. But for me, planetary health framing makes the most sense. And it's because it reminds us of our interdependence with planet Earth and highlights the need to reset, to rethink about our future and that of planet Earth and all other life forms on how we go forward as a more compassionate, more respectful human species and better stewards of life. So hopefully the planetary health framing will lead us forward. Thank you.
Awesome. Thank you very much, Maria. And I'll give the last mic to our Executive Director, Jemilah Mahmood.
Thank you, Renzo, and thank you for so, professionally moderating this rich discussion. Really huge thanks to you. I think that, you asked, what do we do now? And I think the first thing is that here's a real opportunity. If anything, I hope the pandemic has woken us up. And open our eyes that there is nothing without good health, and good health cannot be created in a medical care complex. It's entirely up to us and our linkages with the environment, social factors. So basically the whole planetary health approach is the way forward. It's a question of when we have another pandemic and not if. Our Earth is in trouble. We are in trouble. So even if we were selfish, do it for ourselves. And I must end with the wise words of Yoda, who said, do or do not, there is no try. So I think we have to try we have to do. It's no longer about, oh, maybe I'll try. We have to commit ourselves. And Sunway Centre is committed to work with, a range of partners who want to see that we will have a healthy human race with a healthy planet and both thriving together. So thank you so much for this.
Thank you so much, Pantry Jemilah. And of course, to Yoda, Star Wars is always a very good source of planetary health wisdom. So thank you very much to our esteemed panel for your invaluable contributions, to our participants for your thoughtful questions and comments, and of course to CASA for being our partner in today's event. Unfortunately, that's the only time we got, but this is just the beginning of our amazing journey and of course our webinar series on planetary health issues and solutions here in Asia and the Pacific. Please follow us on Facebook, Twitter, Instagram, LinkedIn. Soon we will be in TikTok to keep abreast of our future episodes. Thank you very much. Stay safe. See you in the next episode and have a good day.